Hello, in this video I will focus on the adjustments of the strategic positioning base for hip rotation when a wheelchair user presents with correctable hip rotation and can achieve a more neutral pelvis alignment in sitting. A non-correctable pelvic rotation may require customization of a Spex cushion. Every Spex Classic cushion has an ischial well to allow the ischial tuberosities and the pelvis to maintain a comfortable seated position. The strategic positioning base can provide the biomechanical support to help block one side of the pelvis from migrating forward. To create a block to rotation, simply add positioning pads to create a pre-ischial shelf to the side we want to support. This is the area just in front of the ischial tuberosities and is forward from the pelvic well that you can see on the top of the cushion. In this video, we will be setting up the cushion to block a rotation to the left. In other words, the pelvis is forward on the right. A helpful tip when contouring the strategic positioning base is to stretch the fabric pockets with your fingers before trying to add multiple pads in. This will allow for easier adding and subtracting of pads. I would suggest that you start with 2 positioning pads and evaluate if this is sufficient to maintain position. More can be added if needed. These are added to the pocket immediately before the pelvic pockets on the affected side. In this case, it will be on the right side. When the wheelchair user is seated on the cushion, this additional block helps the ITs to remain in the ischial well. This optimizes pressure distribution, a more neutral and corrected pelvic alignment, and a more stable base of support. It is important to ensure that additional support by way of a pelvic support strap or anterior positioning belt is also considered for users with high tone, extensor thrust, and/or posterior pelvic tilt. Adding 1 or more additional pads along the length of the thigh on the affected side can help to reduce extensor and rotational force that causes the pelvis to migrate. Importantly, these can be increased and reduced according to the wheelchair user's needs and comfort. We need to be mindful of hip flexion asymmetry and ensure that we have assessed that this isn't a contributory factor to pelvic rotation. Please refer to the Spex Flex video for more information on this. As with any wheelchair cushion, skin integrity does need to be monitored following any changes, and this is recommended practice following any cushion adjustments. As with all adjustments to the cushion, these can be increased or reduced over time. This means we can provide gradual intervention and correction. Using the Spex Classic cushion is simple and effective. The strategic positioning base is simple to use and effective to ensure wheelchair users are sitting according to their correct clinical evaluation whilst bringing comfort, increasing sitting tolerance, and decreasing pain. Thank you for watching.